Hi, this is Dr. Sai Praveen Haranath from Apollo Hospitals, Hyderabad. I'm a pulmonologist and a critical care specialist. I've almost forgotten what COVID is like. We're hardly seeing any cases now. But just think back 2, 3, 4 months ago, a year ago, 2 years ago, all we could think about was COVID. It's a good thing that we are forgetting COVID. However, some people can't forget it. Unfortunately, some people didn't make it through COVID. But those who did make it are actually having some symptoms now. Not everybody, but some of them. And some of the lung-related symptoms you should watch out for are breathing difficulty, and a lot of times the breathing difficulty is not always from COVID. I've seen patients who had heart problems which were not diagnosed during the pandemic, and now they're showing up with chest pain and in fact sometimes breathing difficulty. It's important to recognize that the human lung can be affected in many ways. Normal human lungs are the size of a tennis court if you stretch them out, and their normal role is to get oxygen and blow out carbon dioxide. What may happen in some situations is that if you had COVID, you could have had some lung damage and you had a scar in the lung, and that part of the lung does not participate in this normal gas exchange. In that situation, you may have shortness of breath. Another long-term consequence of people who have had COVID and who are in the hospital is that they may have muscle weakness. They may require exercises to build the muscles of the chest as well as the rest of their body. Another thing we've been seeing is patients who've had depression, anxiety, sleep disorders show up after COVID. It has been stressful for many people, and it's important to consider meeting with a healthcare professional or a mental health professional to discuss your concerns. So COVID has gone, but some people have been left with some scars. Almost 500 million people have had COVID, but over 10 billion doses of vaccines have been given. And if you haven't been vaccinated, think about getting vaccinated. So hopefully we don't see more of the COVID issue again, but even today over 2 million people have had COVID around the world as a new diagnosis. So it's not yet completely gone, but take a deep breath and you should be fine. Thank you.